So this is part two of my video. I'm gonna be doing his his cardiac assessment, and so basically I'm going to introduce my name. Justin, my name is Jeff. I'm gonna be a nurse for tonight. Is it okay if I do a lung assessment on you? Okay, so I'm gonna make sure I wash my hands. And I had pre-approval of taking off his shirt, and he gave me okay with that. First thing I'm gonna do is I'm going to inspect him. I'm gonna be looking for any sort of ventricular pulsations. I'm also looking for any sort of surgical scarring, surgical sites, maybe a defibrillator, ICD insertion, which I don't see. I don't see any bulging of his chest. Next thing I'm gonna do is I'm going to ask the patient to turn your head to the left slightly. Okay. And since he is at a 45-degree angle with the pillow behind his neck, I'm going to be looking for any sort for his jugular vein, and I do see his jugular vein just ever so slightly moving laterally parallel with his neck here. All right, and then the next thing I'm going to do, I'm going to palpate. I'm going to palpate his jugular vein here. Ever so slightly. And I'm going to do one vein, one side at a time to prevent blood flow to his brain. Looks like toothless and strong. And Justin, can you look ahead? The slight pulse here. Toothless and strong. So his carotid pulses are toothless and strong bilaterally. Next thing I'm going to do is I'm going to palpate his breast tissue. I'm going to start off with the right sternal border at the second intercostal space. There's the aortic area. And then his left sternal border, which is the pulmonic area, second intercostal space. And I'll move down to the third intercostal space here. And the fourth, the fifth, which is the Erb's point, and then mid-clavicular line. I'm going to go down in intercostal space here. This is also the point of proximal impulse, the apex of his heart. I'm going to also be feeling for a ventricular pulse, which I do feel. Next, I'm going to listen to it. I'm going to start doing listening to to his heart. And one thing I want to note about the stethoscope, this stethoscope has the bell and the diaphragm all incorporated to one side. So what I'm going to do is I'm going to listen to his carotid artery. I'm going to be feeling for the thrill and listening for the bruit. So let me just palpate him here. I do feel the thrill, and just look straight. I'm using my index and my middle finger. I'm not using my thumbs when I'm palpating here. And I do feel the thrill. So I'm going to listen to it here. Right, just look straight. Chin up a little bit. All right. Okay. And the other side. And the bruit is basically a turbulence of blood flow going straight, to his head. And then I'm going to listen to his heart sound here. Second intercostal space. I'm going to move from the right to the left, and I'm going to move my way down on his left side. Second intercostal space. Left side here. Second intercostal space. I'm going to go down inch by inch. The third, so the fourth, Erb's point, mitral valve area, and then I'm going to go down to the apex here, his apical pulse, which I'm going to get for 1 full minute. So I got an apical pulse of 65. I was listening for an S1 and S2, which I did hear. I also did not hear an S3. I did not hear any gallops. I did not hear any sort of other abnormal cardiac murmurs. Next thing I'm going to do is I'm going to be assessing his pulses, his brachial pulses, his radial pulses, popliteal, and his dorsalis pedis. So I'm going to first start off by going to his brachial pulses here. I'm going to check bilaterally every pulse I assess for. I got his brachial pulse here. 2+ and strong. And notice I'm using my index finger and my middle finger, no thumbs. So his brachial pulses are 2+ and strong. His radial pulses. 2+ and strong. Two plus and strong. So, as I'm checking his pulses, I'm also assessing for any sort of peripheral edema on his arms, which I don't see. And then moving on down, I'm going to check for his capillary refill. And basically with this capillary refill, I'm going to be pushing down on his fingers, and I see it turns white, but as soon as I let go, the blood returns to his fingers in less than 3 seconds. Checking all his fingers here, including his thumb. Okay, so good capillary refill. Pushing down on his fingers here. I see the color returns back. Okay, and the next thing I'm going to do is I'm going to have his hands turn out like this. So Justin, flip your hands over. Okay, and I'm going to do a test called the Allen's test. Basically, I'm going to ask him to clench his fists a couple times. Okay, and I'm gonna see if I can grab his radial pulse and his ulnar pulse. I'm gonna push down so lightly, and I see that his skin turns into that pasty white color, and I'm gonna let go one pulse at a time. I'm gonna let go. And I do see that it turns back to his normal state of color. Same thing over here. I'm going to hold down his hands, his pulses here, his ulnar and his radial pulses. I see it turns into that whitish color. I'm going to let go here and one arm at a time. And I do see it turns back to that pinkish color, the normal color of your hands. Moving down to his legs, I'm also here assessing for any sort of edema, which I don't see on his right leg. And I don't see on his left leg as well. Okay, so I'm going to check his popliteal pulse. Basically, I'm going to grab his knee, at the back of the knee, with my hands here. I'm going to flex it a little bit and dig a little light so I can feel it, which I do. And they are 2+ and strong. Okay, I'll return his leg back here. Do the same thing to his left knee here. Dig a little lightly. There you go. 2+ and strong. So his popliteal pulse are 2+ and strong bilaterally. I'm going to look for his dorsalis pedis, which is on the close by his toes. I'm going to see if I can find it. Okay, there it is. 2+ and strong. Pulse are 2+. Okay, good. So his dorsalis pedis are 2+ and strong bilaterally, which is a normal finding. The last test I'm going to be doing here is called the Holman's test. Basically, I'm going to flex his foot, and I'm going to ask him if he has any pains, and I'm also going to check his calf, behind his leg, to make sure I don't feel any warmth. So Justin, can you flex your foot for me? And then, do you feel any pain?
No.
No? And I don't feel any warmth here, which is a good sign. Negative Holman's test on this side. I'm going to check the same thing here. Can you flex your knee for me? And I'm going to check the back of your calf. Feel any pain?
No.
Alright, I don't feel any warmth either. So, both of his legs got a negative Holman's test, which is a good sign. This concludes my cardiac assessment. Thank you for watching.